My name is Harriet Kilpatrick. I'm a fertility AI consultant at harrison.ai. I think what attracted me to working at Harrison was that when I look at my career to date, it didn't really make sense in that I had this bit of management consulting, sort of technology experience working in professional services, and then I had this real clinical specialism in terms of IVF and fertility, and I didn't really understand, I guess, how the two would fit together or if they really would. So I feel really lucky in that joining Harrison, it's somewhere that I can bring both of them together. It was actually when I was working as an embryologist in an IVF clinic. So something that was a big challenge on a daily basis to us was actually choosing the right embryo to transfer back to a patient, making sure it was the best quality one and most likely to become a baby. And AI was something that could really help support this decision. And I actually heard of Harrison working on quite a cool collaboration with a competitor clinic of ours on this tool, and I remember being quite jealous at the time that they weren't working with our clinic. So that was when I first heard of Harrison. Yes, so my job so far at Harrison AI, initially I started working very closely in the fertility sector. So we were looking for other opportunities to use AI across IVF. More recently though, I have moved a little bit more into other areas of initially women's health, working within the sort of diagnostic radiology space to try and develop new products using AI for radiologists. It's very collaborative, and I think as a group of people it's very accepting, and by that last one I mean it in two parts. So everyone kind of comes from a different background and brings something different to the table, and I feel like everyone is accepted for the skills they have and the expertise that they bring, and everyone kind of has a place in the team. I think as well, everyone has slightly different circumstances. So some people are clinicians working clinical rosters, so their days of the week change, and that's fine. Everyone kind of fits in around that. Some people have young kids that they need to also juggle with work as well. So I think it's a very accepting place to work. I think in the next year, that's an easy one. Hopefully another joint venture in another healthcare vertical. I think in 5 years it would be really cool if we were able to maybe establish something more internationally, maybe with a bigger company on a more global scale. So I think that's what I'd like to see in 5 years.